How to get vitamin D naturally. Vitamin D is a fat-soluble vitamin and is produced in the body when skin is exposed to sunlight. This is why it is often called the sunshine vitamin. You can also get vitamin D through your nutrition, which is absorbed by your body during digestion. If you need to get more vitamin D, there are natural ways to get it. Exposing yourself to the sun. Learn how the sun creates vitamin D. Sunlight is a form of radiation that has two forms, ultraviolet A, UVA, and ultraviolet B, UVB, radiation. Your main source of vitamin D occurs when UVB radiation strikes your skin. When this happens, the first steps of vitamin D synthesis in your body is triggered. After this, the next steps occur in the liver and then the kidneys. Because the rest takes place inside the body, once the body is triggered, you no longer need to be exposed to UVB radiation. Spend enough time in the sun. Since sunlight spawns vitamin D production, you need to spend time in the sun without protection. You need to let your exposed skin get access to the sun a few times a week. It is recommended that amount of time you should spend in the sun is half the amount of time it takes for your skin to turn pink. Most children and young adults need to spend 20 to 30 minutes outside, 2 to 3 times a week with bare arms, legs, and face to synthesize enough vitamin D to prevent deficiency. Although sun is important, using a tanning bed as a substitute for sun is not recommended. Tanning beds increase the risk of skin cancer. In one study, exposure to afternoon sun long enough to get mildly pink skin, for light-skinned people, was enough to produce 10,000 to 25,000 DU of vitamin D. Individuals with darker skin need more sun exposure, and need to spend 3 to 6 times longer in the afternoon sun to get the same amount of vitamin D. The reason for this is that darker skin contains higher amounts of melanin, a skin pigment whose function is to protect skin cells from UVB radiation. Older adults need to spend more time in the sun to get the same effects as well. Get the right kind of sun. There are many factors that should be taken into consideration when getting the right sun. Your location and the season of the year can make a significant difference. In addition to season, skin color, and presence of sunscreen, the amount you get also relies on the amount of cloud cover and pollution in the area. For example, 15 minutes of sun exposure on your hands, arms, and face at around noon in Miami, Florida throughout the year is roughly equivalent to 1,000 DU. In other areas north and south of 40 degrees latitude, which in the United States is around Boston, there isn't enough UVB radiation to stimulate vitamin D production during from November to March. In Canada, this extends from October to mid-March. This time period is known as the vitamin D winter. Avoid wearing sunscreen. Sunscreens, which block UVB radiation, significantly decrease vitamin D production. This means that you need to be in the sun without sunscreen. However, if you think you are going to spend more than 20 to 30 minutes in the sun, then you should wear sunscreen. Using diet. Get the right amounts of vitamin D. The recommended daily amounts for vitamin D vary according to age but are the same for men or women. The breakdown of recommended daily amounts are: birth until 12 months old need 400 U, 10 mcg. 1 year old until 70 years old need 600 U, 15 mcg. Over 70 years of age need 800 U, 20 mcg. Women who are pregnant or breastfeeding need 600 U, 15 mcg. Find the right source. There are not that many foods that contain vitamin D. There are some additional foods that have been supplemented with vitamin D at varying levels. The foods highest in natural vitamin D include cod liver oil, which has 1,360 I per 1 tablespoon. Wild caught swordfish, which has 566 I per 3 ounces. Wild caught salmon, which has 447 I per 3 ounces. Wild caught tuna fish, which has 154 I per 3 ounces. Fortified milk, which has around 120 per 2 cups. Yogurt, which has 80 per 6 ounces. Sardines, which has 46 per 2 sardines. Beef liver, which has 42 per 3 ounces. Eggs, which has 41 per 1 large egg. Swiss cheese, which has 6 per 1 ounce. Ingest vitamin D. Given the variety of foods that have vitamin D, there are many ways to get the right amount each day. The simplest way is to have 1 tablespoon of cod liver oil daily. This oil tastes terrible, but you can mix it into a vegetable smoothie or divide it up into smaller doses. Incorporate 1 or 2 servings of any of these listed foods into a recipe or during your meals every day. You can also eat fewer servings each day and spend some time in the sun, to make up the difference. Understanding vitamin D. Learn the benefits. One of vitamin D's primary functions is to help calcium absorption in your system. This is important because calcium is necessary for bone growth and bone remodeling, which are constant processes in the body. Vitamin D is also needed to prevent rickets in children as well as osteomalacia, softening of the bone, and osteoporosis, brittle bones, in adults. Vitamin D also contributes to the proper functioning of the immune system as well as cell growth and cell regulation. Low levels of vitamin D also can increase the risk of pancreatic and colon cancer. Autoimmune disease, type 1 and type 2 diabetes, high blood pressure, insulin resistance, prediabetes, and multiple sclerosis. No risk factor. There are some people who are more at risk for vitamin D deficiencies. This means if you are one of these individuals, you need to pay more attention to how much vitamin D you get every day. These people more at risk include breastfed infants, older adults, anyone with limited exposure to the sun, individuals with darker skin, individuals with inflammatory bowel disease, IBD, or any other condition with fat malabsorption, overweight people, obese people, or those who have had gastric bypass surgery. Get healthy levels. In general, 15 mol of vitamin D in your blood is considered to be at healthy levels. Values lower than this is considered low, which means you need to up your dose. A doctor will generally suggest food and sun with additional supplementation if needed, though supplementation is recommended after. Keep in mind that vitamin D, like other fat-soluble vitamins, can be toxic at high levels. This means you can have too much, which is not good for you. Excess vitamin D can cause anorexia, weight loss, and heart problems.